How to tell if it's psoriasis or dermatitis. Are you wondering how to tell if your skin condition is psoriasis or dermatitis? While both can look similar, they have distinct features that can help you identify which one you might have. Let's break it down together. Psoriasis is a chronic autoimmune condition. This means your immune system mistakenly attacks healthy skin cells, causing them to grow too quickly. This leads to thick, raised patches covered with silvery white scales. You might find these patches on your scalp, elbows, knees, or lower back, but they can appear anywhere. Psoriasis plaques usually have well-defined edges, thicker and drier scales, and they can crack and bleed. Sometimes, psoriasis can affect your nails, causing pitting or thickening, and it can also lead to joint pain known as psoriatic arthritis. If you have psoriasis, you may notice that the patches can be sore or tender, and if they are on your scalp, they may extend beyond your hairline. On the other hand, dermatitis, particularly seborrheic dermatitis, is mainly an inflammation of the skin. It is often caused by irritation or an immune response, but it is not an autoimmune condition. This type of dermatitis typically shows up as red or pink inflamed skin with thinner, flaky scales that can sometimes appear oily and yellowish on lighter skin tones. Seborrheic dermatitis usually affects areas rich in oil glands, like your scalp, face, and body folds. The scales here are generally less thick and less defined compared to psoriasis. You might experience itching or burning, and the flakes, often referred to as dandruff, are usually easier to remove. Unlike psoriasis, dermatitis patches typically do not extend beyond the hairline and rarely affect your nails or joints. To help you differentiate between the two, here are some key points to consider. First, look at the scale thickness and appearance. Psoriasis scales are thicker, drier, and silvery white, while dermatitis scales are thinner, flaky, and may have a yellowish, oily look. Next, check the patch edges. Psoriasis patches have well-defined edges, whereas dermatitis patches are often less defined. Also, consider the location and spread. Psoriasis can extend beyond the scalp hairline and affect multiple areas, while dermatitis usually stays confined to oily areas. Another important factor is nail and joint involvement. Psoriasis can cause nail pitting and joint inflammation, but dermatitis does not. Lastly, think about your symptoms. Psoriasis patches can be sore or tender and may crack and bleed, while dermatitis patches tend to itch or burn but are less likely to crack. If you are unsure about your skin condition, it is always best to consult a healthcare professional. They can provide a proper diagnosis through a clinical examination and, if needed, a skin biopsy. Remember, symptoms can overlap, especially on the scalp, so a professional evaluation is key to getting the right treatment. In some cases, it is even possible to have both conditions at the same time, which is known as sebopsoriasis. So, if you suspect you have psoriasis or dermatitis, reach out to a healthcare provider for personalized advice and treatment options.